week, Health Minister Dr. Zweli Mkhize said that he was cautiously optimistic about coronavirus cases in South Africa having passed the peak. This was in response to the decline in reported daily infections. He also mentioned that the Eastern Cape, Gauteng, and the Western Cape seem to be showing a downward trend. So are these signs that we're starting to win the fight against COVID-19? Epidemiologist and chairperson of the COVID-19 Ministerial Advisory Committee, Professor Salim Abdool Karim, joins us now to talk about this. Professor Karim, a lot of people have mixed views when it comes to the second wave. A lot of people have mixed views when it comes to the numbers that we're seeing making a downward trend. But I just want us to begin here tonight. We keep hearing about the second wave, and a number of countries as well have been talking about the second wave. What exactly is the second wave?
Good evening from you, and good evening to the viewers. So when we look at the way in which this virus spreads, the traditional, not the traditional, but the way in which it has spread in most countries is that you get a very rapid rise in the number of cases and you hit a peak and then it slowly comes down. And while it's coming down, in some countries, there is a sudden increase in cases. In other countries, it'll come back down to quite a low number and it'll simmer there, and then they get another rise towards the peak. So it's this unexpected second rise in the number of cases that is referred to as a second surge. Initially, they used the word waves. We would see a second wave, a third wave. And that's a bit confusing in terms of terminology, because with the waves, you're expecting to see a slightly modified virus. In our case, it's the same virus that's now spreading throughout. There are a few different forms of the virus, but they are the dominant ones, and they are the ones spreading. They're just causing new peaks. And so that's why it's referred to as a second surge.
And when we look at, just how other countries have been dealing with it, we saw the United States really having a record high just in the past few days, reaching 5 million cases. How would you say South Africa should be handling, what the minister has warned as the second wave?
Yes, absolutely. It's a very difficult situation. Let me perhaps share some data with you. If you just give me permission to share my screen, I will show you some information, because I think what's somewhat confusing at this point is, have we finished the first peak? Have we finished our first surge? Because if we've finished our first surge, then we need to be thinking about when is the second surge going to occur. But if we haven't finished the first surge, then of course that's a pointless discussion to talk about a second surge if we're still in the midst of the first one. So it'll be useful to get some idea about where we are in the overall, in the natural consequence of the way in which this virus spreads. I wanted, if somebody can give me permission to share my screen, I can show you some data that will help, some graphs that will show, it will help understand the situation.
And Professor Karim, I'm going to ask...
Show the slides.
Yes, and that's definitely what we are going to do tonight, to give you permission to be able to share that slides and the slides that, we were talking about earlier on with me. I just need us to go for a quick ad break, but when we come back, you'll take us through the data so that we get a sense of, where we are. As you say, a very important point, have we finished the first surge? That's going to be interesting there. You do not want to miss this presentation that Professor Karim has for us tonight, just to take us through the data of how things are looking like and how South Africa should be preparing for the next phase. Let's go back to Professor Karim as he just talks to us about, whether or not we actually are over the first wave, and also now hearing talk of the second wave. Even the minister, the health minister, Dr. Zweli Mkhize, being cautiously optimistic about some of the numbers and the downward trends that we have been seeing in recent days. Professor Karim, you had that, the data that you wanted to share with us and the viewers tonight, just to give us a sense of what is happening.
Sure. I'll share with you some data. If you can just confirm that you can see it right now.
Yes, we can see it.
Okay, so what you are looking at is a 7-day moving average of the numbers of new cases. The reason for calculating a 7-day average is because you have a lot of variability, what we call background noise, that occurs if you just look at each day's number. So what we do is we take each day's number, we calculate a 7-day average, and that average then moves because we are taking different 7 days for each day. So that allows you to look at a pattern that will emerge. And what becomes clear when you look at it is that when we eased restrictions on the 1st of June, it took about a week or so, and the number of cases started rising. They rose rapidly at the end of June and the beginning of July, and then they went into this kind of peak in the middle of July. And then from the latter part of July, they've started coming down. So that's the pattern that you are currently seeing. So this pattern on its own is not clear as to whether we genuinely are coming down or whether this is just a short-term artifact. So the one way of looking at it is to look at that same line. So that's the line, that's the 7-day moving average. You look at it in relation to the number of hospital admissions. And each bar here is again a 7-day moving average of the number of hospital admissions in sentinel hospitals. So this is not all hospitals in South Africa, it's just a selection of hospitals. So if you look at that pattern, it's very interesting to see how at the top end of the curve, we had very large numbers of admissions. Now that we are coming down in this curvature, the number of admissions is also coming down. Now remember that the last few bars still need to be adjusted because of the lag, so you can't make too much of that. But what you can say very clearly is that there's a downward trend in the number of admissions. And that holds true if you talk to doctors in the hospitals in the Western Cape or Gauteng. They'll tell you there are now fewer admissions and they even have, beds available. So this is a very promising trend. If you are seeing both the cases come down and the number of admissions comes down, then that's a good sign, because it means that they're tracking with each other and that it's not just an artifact, that it's something that's probably real. But because it's only just been doing that for just a week or two, it's not enough to know whether it's going to be a consistent trend. We need to know that this is consistent and holding. And so that's why I've referred to it as this is a promising trend, but too early to make any firm conclusions. Now, when we look at the same graph, again, this is the graph of the number of cases. That's the same black line. But instead, at the bottom here, I have the proportion of PCR COVID-19 tests that are positive. Now, the test positivity rate is quite an important indicator because it tells us how we are doing in relation to the test that we are performing. And that will be one of the most important indicators that we look at to determine whether our trends are now consistent or not. And very interestingly, you can see how the test positivity rate went up. So at this point, in about June or so, we were doing roughly about somewhere in the region of around 12 tests to get one positive result. At peak, that's in the middle of July, we were doing 4 tests to get one positive result. Right now, we are doing about 5 tests to get one positive result. So one would like to see this graph come down substantially more. We'd like to see it closer to the 10 to 15% range before one could say, I'd be willing to say that this is a trend now that is much more secure. At this stage, this trend is too tentative. And because this proportion is still high, I would be hesitant to say that we are now over the peak. Instead, I think it's better to say that it looks like we have a promising trend that's downward, but it's too early to tell for sure. Now, why is all that important? It's important because we want to answer the question, could South Africa have a second surge? Well, this is the South African graph, the one I've just shown you. Right? That's what it looks like when you flatten it a bit and you create a standardized curvature for all the different countries. So the first thing to do is compare it to Germany. So Germany had one of the most successful efforts to prevent the coronavirus. And what you see is that, and all of them start from the same point, from the day the first patient was identified with COVID-19. You can see that Germany had a peak very early, then it came down, and it's been consistently at a low level since then. South Africa, in comparison, didn't have an initial burst. An initial peak was averted in South Africa. And the reason it was averted is because of the very early action that was taken. So we didn't have that very early peak. Instead, we had our peak as the restrictions were eased. And our peak rose, and it's now on its way down. It's not yet clear whether this downward line is going to continue to the bottom or whether it might change. Now, why are we worried about it changing? We worry about it changing because of what we saw in the US and in a few other countries, that the line went up, it started coming down, and then what happened as it was coming down, they eased restrictions and it started going back up. And the second surge was even higher than the first surge. And so that's what we worry about. We worry about this line not coming down completely, not coming down all the way to the bottom and staying at the bottom. Let me give you a third concern, and that is using Spain as an example. So Spain, like most other countries, from the time they had their first case, they have a rapid increase, they have their peak, and then it comes down slowly. And then when they got to the bottom, they stuck at the bottom and they had just a few simmering cases. And what has happened since then? In the last 2 to 3 weeks, they've started a second surge. They've had several outbreaks occur, and now this line is going up again. So we have to be deeply concerned about a second surge that may occur with our first surge, or it may occur at a distal time. At this point, it is too early to tell whether this curvature is now clearly on a downward slide, and we can be confident that it's going to come down to the bottom. So I can summarize it. We have a promising downward trend that promises both from the number of cases and the number of admissions. We're a bit concerned that the proportion of tests that are positive is still quite high, and that's a sign we want to see lowered. And then when we compare ourselves to other countries were in the same position as we were, and then they had a second surge. So we currently are running a risk of a second surge, and it remains for us a concern. that we would have to avoid. And the way to avoid it, of course, is to be much more diligent and no complacency. You've got to keep your mask, you've got to keep our distance, we've got to be very good at doing that. And I'll stop there.
And Professor Karim, that is such, an interesting, presentation. For me, it opened my eyes to a lot of things. And we have been even hearing the minister, even last week, when he came out to talk about how, some were expecting South Africa to even reach the level of Spain, the level of Italy, because that was basically what was anticipated here. But as you warn against laxity there, which is something that government officials are also warning against, there are some calls in some provinces for, the alcohol ban to be lifted. And we do know that, medics have been saying in hospitals that they have been seeing less trauma cases and they've been able to focus on the very cases that they need to focus on. Do you think it's time, while, we're asking South Africans to wear their masks, practice social distancing and everything else, to maybe ease up on some of these regulations?
I think the main issue with alcohol is our deep concern that it uses exactly the same healthcare services that we need for COVID. Using the emergency room, using the ICUs, using oxygen, theaters, and so on, because of the motor vehicle accidents and the interpersonal violence. As the number of cases are going down and our admissions are going down, the pressure on the hospitals is now being eased. And as that pressure is being eased, the burden that alcohol would place on these hospitals, we should be able to cope with it. Whether we would be able to cope with it just at this time, I think we're just at that cusp. Probably another week of information will give us some clarity about whether the admissions and the rate at which admissions are coming down and the rate at which cases are coming down, whether that's nice, consistent, and so on. Because the last thing you want is to undo something and then your hospitals are now flooded again with cases. So we need to just be sure that we are on a very firm footing when we make such a decision.
Professor Karim, I know that I had said I'm only going to keep you for 30 minutes, but I see my mentions on Twitter are going absolutely crazy tonight. We have a lot of callers on the line that are also just hoping to get some questions to you. If I can ask you, please, to stay on for us just for a little while longer, just the viewers to be able to ask you questions and get some answers. Would that be okay?
Yeah, sure. I'll be here. I can stay on for another few minutes.
Thank you so much. Thanks. We continue with Professor Karim just on the other side of this as we take your questions. Okay. Hi, Tabang. It's Bongiwe. Can you hear me? Hello, Tabang. It's Bongiwe.
Oh, hello. Yes, I can hear you.
Please stay on the line for us. We're going to take you first, and you can ask your question to Professor Karim. And let's try to keep it short because he's not staying for too long with us.
Okay. No, it's fine. I'll do that.
Thank you. Please stay on the line.
All right.
Thanks for staying with Flatten the Curve tonight. Let's remind you of our poll question. South Africa has recently been reporting lower daily figures of new coronavirus infections and an improved recovery rate. Do you think we're starting to win the fight against COVID-19? You have two options there. It's a yes or no. Let's begin with the calls tonight. Tabang, good evening. What's your question for Professor Karim?
Good evening to you, Bongiwe, and to your viewers at home. So I'm not going to take time, but allow me to send my sincere greetings to your guest tonight, Professor Salim Karim. I would like to send warm and best wishes to you and your colleagues as you continue on your advisory work to the South African government on the battle to control the spread of the coronavirus disease. This is without a doubt a real battle for countries such as ours who found themselves in top 5 worldwide. Well, we see the cases curve going down, and that is very positive news. But unfortunately, this has left so many impacts into our lives. The disease has affected us in different ways. Now, I would like to know, in terms of your general observation, how has this virus affected mental health of South Africans? And what has been your role in providing guidance and advice on managing mental health challenges caused by this pandemic?
Professor Karim?
Yes, thanks very much, Thabang. You raise a critically important question. If I might just take the opportunity to say that yesterday I attended the funeral of a close friend and colleague, Anil Bhagwanji, a psychologist who was advising the Ministerial Advisory Committee and the Minister on mental health issues, and particularly around behavior change. He acquired COVID about 3 weeks ago and demised a few days ago. It was indeed a sad loss. We have used people like Anil Bhagwanji and many other psychologists and people with experience in behavior change to provide some advice on this issue. But our expertise in mental health is somewhat limited. Despite that, we remain concerned. There are about 3 or 4 different areas that we have been concerned about. The first relates to the isolation of individuals, the lack of human contact. The second relates to the issues of bereavement and the lack of closure that we have because of the way in which funerals occur in this situation. The third is the deep anger, frustration, and the way in which people who are scared of this virus are dealing with it. And then the fourth is the way in which it has impacted in a range of ways we did not anticipate. Some of it relating to gender-based violence, some of it relating to the way in which individuals are interacting with each other that involve violence as a manifestation of mental ill health or frustration that occurs. So all of those are important issues that we have to deal with and beyond. And they are part and parcel of our overall response. The extent to which, we will be able to get through this period and emerge from it with the ability to rebuild our society, rebuild our economy, is going to be critically important. And mental health plays a big part of it and is a specific issue in stage 7 of the response to COVID-19.
And Professor Karim, some of our viewers have been asking questions on social media tonight. Let's have a look and see what some of the burning questions are. Puti Matlala saying, the original prognosis indicated that South Africa will peak around mid-August, meaning beyond this, no amount of lockdown will have a major impact. What are the scientists saying on how we must now learn to live with the virus?
So when we look at the situation as it stands with the downward trend that we are seeing, there is really no benefit to extending any of the restrictions of the lockdown beyond what we have. The question of when to ease the restrictions, there are many different views on that. My own view has been that when we have a consistent downward trend in the proportion of positive tests, I think we will be much more confident that the downward trend is now secure and is not going to turn upwards. My big concern in all of this has been the way in which the epidemic will unfold in KwaZulu-Natal, because it has the potential to really change the curve that we are seeing. And we could quite readily become a curve that looks more like the US in terms of turning upward, or in some of the other countries where the surge did not complete into a low baseline thereafter.